Hello, good evening, and how are you doing? Welcome to another session of Ask the Doctors. How are you doing? Happy Sunday to you. So, we're going to be very fast because I know that some people are very interested in watching the ongoing Nigeria versus the Democratic Republic of Congo. There's a match going on right now. But let's see if we can in the nearest let's say 30-45 minutes we will be done. Yeah, so let's talk about recurrent infections. There are many reasons why people have recurrent infections, but before we start, I want you to tell me, where are you watching me from? If you know you can see me and you can hear me, I just want you to tell me briefly, where are you watching me from before we start talking about recurrent infections. So quickly, yes, let's go. Oh, yeah, tell me, where are you watching me from? If you drop any comments, I can surely see your comments on the screen. Yes, I will see your comments. So where are you watching me from? Yes, good evening, and how are you? Oh, yeah, recurrent infections, Yes, let's see. I want to be sure that I want to be sure. Good evening, and how are you? Okay, good, good, good. Yeah, the sound is great. Yes. Watching from Akwa Ibom, Joseph Udo or Udo. Did I get it correctly? Joseph, did I get it correctly? Tell me. Uh-huh. So let's see. Oh yeah, tell me, where are you watching me from? We'll be talking about recurrent infections. A lot of people have been complaining, doctor, I treated this condition and it came back. I had this problem and it came back. Why? So I felt it's important. NOSA Arts and Motion. NOSA is watching us from United Kingdom. I believe you can see your comment on the screen, right? If you drop any comments here, you will surely see your comment on the screen so that you know that your comment is appearing here. Good. So let's see. Yes, where are you watching me from? Quickly, ladies and gentlemen, tell me, where are you watching me from? I'm waiting. I'm waiting. Yes, I can. Richard, good evening, Dr. Fredo. Richard Daniel from Abia. No, sir. Yes, I can hear you. So quickly, let's be fast. You try. Let's see. Udo. Okay. I got it. So let's talk quickly about recurrent infections. Why why is that some people complain of recurrent infections? I treated this condition, and after a while it came back again. I know that Nigeria is having the match right now ongoing, but let's see if we can be very fast right now. There are many reasons why. Number one is that it might be from that person, that's that individual. It can be from that individual. Maybe this person has a problem with his or her immune system. Okay, you're watching from Nasarawa State. I can see we have somebody else again watching us on YouTube. Who is this? Yes, David. We have somebody else watching us. Good evening. I'm watching from Edo or via Southwest local government. Okay, good. I see you, Didi. I see your comment. I see your comments. Richard. Okay, so Nigeria just called. Yeah, Nigeria has just called. Good. Let's see. Joy, good evening. Welcome. So there are many reasons why someone can have recurrent infections. And number one is that it might be from the individual. It might be from their weak immune system. Maybe your immune system is not protecting you enough. And there are many reasons why your immune system can be down. So many reasons why. And that can be due to, number one, it can be due to infections like HIV. It can be due to diabetes. It can be due to chronic stress. It can be due to some medications like chemotherapy. And so if every time you are complaining, doctor, they get infection, they get infection, it might just be due to a problem with your immune system. Are we together? Are you following me at all? Oh yeah, now let me know. Huh? If you are following me, let me know that you're following me quickly. Oh yeah, let's go, let's go. I want to be sure that you are following me. Huh? Yeah, I want to be sure. I want to be sure that you're following me. Huh? Quickly, let me know. I'm watching from Zimbabwe. Yes. Okay. Joseph says yes. Follow me. Okay. Good. Now, another reason why somebody can be having a problem with recurrent infection is your lifestyle, your behavior, the way you behave. There are a lot of people with poor hygiene. I'm following you. Very good. Okay, good. Richard, I'm following you. Janke from Gambia. Some people have very poor hygiene. The way they take care of themselves, the way they clean up is quite very, very bad. They don't have good sanitation. The way they take their bath is very poor. The way they handle their foods, extremely poor. So for this reason, they might be exposing themselves to recurrent infection. Huh? You understand? Good. So we are talking about recurrent infections, please. So that in case you ask us any question that is not related to this topic, we might not take care of your question tonight. We are talking about recurrent infections. So I spoke about the immune system, I spoke about behavior, poor hygiene, poor sanitation. The way they handle their food is quite very poor. The way they clean their body is quite very, very poor. And that reason again is the lifestyle, smoking and alcohol. Smoking and alcohol can also suppress your immune system. Smoking and alcohol can affect the way your body handles all these microorganisms. So if you smoke, oh my God, should I switch? Okay, so if you smoke or you take alcohol, one way or the other, you are exposing yourself to recurrent infection. So if you are listening to me right now and you have been battling recurrent infections and you smoke and take alcohol, that might just be one of the reasons why you might be having the problem. Another one again is your sexual life, unprotected intercourse. There are a lot of people, the way they engage in sex is so very poor, very, very poor. You have multiple partners, you don't use protection. Every day you're coming down with different forms of STDs. This might be one of the reasons. So if you are listening to me this evening and you are complaining of recurrent infections, doctor, I treat this problem, it's coming back again. Ask yourself, what is your sexual life like? Do you have a good sexual hygiene? Do you protect yourself? Do you have multiple partners? Do you understand? All these things increase your risk of coming down with infections. Now, another thing again that can make you come down with infection is when you skip your medications or you stop your medication. So a doctor sees you, you go to the hospital, and doctor says you have this problem, and they give you antibiotics. And the doctor says, take these antibiotics for 10 days. And then you say, doctor, I don't like taking antibiotics, so I don't like it. Doctor has appealed to you. Take the antibiotics once daily for 10 days. So you took these antibiotics the first day, the second day, you skip the third day, you skip the fourth day, you resume the fifth day, sixth day, you stop seventh, eighth day. Listen carefully. there's a very high chance that that infection will come back again. Are we together? Please share. Let me check if you have shared. Can you please share this live session, ladies and gentlemen? I want you to share the live session quickly. Can you please share the live session? Oh yeah, share. Let me check. I want to be sure that we are together on the same page. Why can't I even see the live session right now? Why can't I see the live session? Share. Oh, let's see. Good evening. Yes. Okay, I'm following you. But why can't I see this live session right now? Let me check again. I want to be sure what's happening. It's not appearing on the page. Why? I don't know why, but we'll fix that later. Okay, so when you skip your medications or you stop your medications too early, you might be giving yourself so many reasons to have infections recurrently. Another reason why you can be having infection recurrently is overcrowding. Overcrowding. I'm here. Okay, I see you. Okpara Lillian. I see you. Overcrowding and poor ventilation. There are some people, the place in which they live is overcrowded. Overcrowded to the point that the people around them, they begin to share these infections among themselves. You live in hostels, in congested homes where people can share respiratory infections. Sometimes the food and the water you drink are contaminated. Poor sanitation, your water is contaminated, the food is contaminated. These are some reasons. And then another reason why you can be having recurrent infection is your resistance. Yes, resistance. You can be having resistance to uh, these antibiotics, these antimicrobial agents. There are some people is whenever they have any problem, you see them. Oh, we have Dr. Israel in the house. Dr. Israel is in the house. Dr. Israel, I can't see your camera. Uh, Somebody say something. He says, Richard says, Doctor, you don't catch me for this one. Once I take medicine and the sickness stop, I know they finish those drugs. Richard, why? Richard, why are you doing this? Yes, Dr. Israel, good evening. How you there? Hello, Dr. Israel. Hello. Okay, so Dr. Israel is battling with his network. Yes, Mr. Richard, why is it that when they give you medicine, you will stop taking your medicine? Why? Are you not aware that you can develop resistance? Eh? You can develop resistance to these medications. I'm trying to bring up Dr. Israel. Oh, okay, let's see. Dr. Israel, can you hear me now? Hello. Oh no. His network is poor. Yeah. Watching from Port Harcourt. Okay. Joseph, what do you mean by same here? Mr. Joseph, why is it that? So I need you all to answer me quickly. Why is it that when you start your medications, after 2, 3 days, you stop taking the medicine? Why? Why? Answer me now. Please. Can you answer me and tell me why? Tell me why, you tell me why. Why do you start your medication and then you stop your medication halfway? Now, what can we do? I'm trying to see if Dr. Israel can hear me. Dr. Israel, can you hear me now? Dr. Israel, can you hear me now? Oh my God. Okay. So what can we do to ensure eh, that we don't have recurrent infection? Number one, very simple. Improve your hygiene. Wash your hands. Wash your hands. Anytime you go to the toilet, anytime you finish using the toilet, wash your hands. Before you eat, wash your hands. Ensure your foods are properly prepared. Are we together? Let's see. How far? What's happening to your network? We can't hear you. Okay. So I'm trying to chat with Dr. Israel. Let's see. Let me see. Okay. Yes. So number one is that take care of your hygiene. Ensure you wash your hand properly. Ensure you prepare your food well. Ensure you cover your food after cooking. Ensure that where you stay is far away from waste disposal. I can't hear Dr. Israel. Oh. Let's see. Okay, we're trying to see if we can hear Dr. Israel. Okay. Doctor, I don't really know. I'm just addicted to that attitude. That attitude is bad, though. Who be this? Mr. Richard. Um, that attitude is very, 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 very bad. Number two, what can you do to help yourself? Take care of your immune system. Take care of, take care of your immune system. You understand? Your immune system is extremely important. Ensure that you rest, ensure that you eat healthy, ensure that you avoid smoking, you avoid alcohol, get vaccinated. These are ways you can help your immune system. Are we together? Okay. Uh Please, the views on the live session is poor. Please, can we help us to share? No, well, a lot of people are watching the Nigerian match right now. Sure you understand. They are watching the Nigerian match, so I'm not really bothered per se. After the live session, some of them might come back and watch. But ladies and gentlemen, share this video. So number one is what? Take care of your hygiene. Number two, strengthen your immune system. Improve your nutrition. Eat balanced diet. Eat fruit. Eat, take fruits and vegetables. Dr. Israel is in the house. Let me see if we can hear Dr. Israel right now. Dr. Israel, oh my God, he's having a very poor network. Okay. When he's up, I'll let you know. Make sure you sleep and rest properly. Sleep is good for your immune system. Rest is good for your immune system. Then get yourself vaccinated. Yeah. Okay. If you are just coming, you're welcome. We are talking about recurrent infections. The truth. What are the things that make people develop recurrent infections, and what can we do to address this? We cannot hear Dr. Israel, oh. But what did they happen now? We're trying to add him to the screen, but we can't see Dr. Israel. What's going on? Uh, we can't. I'm trying to add him.
Let me
Okay. Yes, Dr. Israel.
Can you hear me?
Okay, I can hear you now. It's breaking, it's cracking up. Can you unmute your mic? Okay. Hello. Hello.
Can you hear me?
Yes, I can hear you. I can hear you, but it's breaking up. Hi. Okay, so if you have
I
questions
just
for us,
unmute.
okay.
Did you hear me?
Let's yes,
Hello,
yes.
can you hear me?
Let me see. Is it my network or your network? Let the viewers. Yes, I can hear you. I can hear you, but it's breaking up. Okay, Dr. Israel. Oh
I
yeah,
don't
go
know.
ahead. Go ahead. Oh yeah, go ahead. Go ahead.
Okay. If you can hear me,
I can hear you.
we dey talk about recurrent infection today, shey. So
Yes.
anything and one wonderful thing when many people, so every 2 seconds people don shout say, I treat am before, e don come back again, and it's always like that for some people, for a group of persons. And this is because of maybe many things about what wetin dem dey do. So yes, one thing about recurrent infection, one way when recurrent infection take dey happen is that if you have any infection, most of the time you also need your partner to be treated. Because if your partner dey not treat your partner, it will become a cycle. The cycle in the sense that you get infected, you treat yourself, you meet your partner, you get infected again. So it become a cycle. So with that, you come dey get wetin you dey call recurrent infection. That one na the first way wey that can happen. Another way when those recurrent infection go fit happen na they give you medication, you not complete the medication. You take the medication reach half, because you don stop to dey see whatever you dey see, you stop the medication. After some time, these things will come back again. So that na recurrent infection. Another one na your hygiene. You not you get infection, you treated it, but because of the kind of way you dey live your life, and the kind of way you clean, the kind of way you wash, the things you wear, you infect yourself again. Recurrent infection just dey happen. Now another one na those people wey dey apply so many things inside their body can actually still cause recurrent infection. And most of the time na women dey quickly dey get this recurrent infection. For men, the one wey go quickly give them recurrent infection na two. One, their hygiene, and two, when they go meet their partner again, they can get reinfected, that cycle of it. But for women, so many things. You not complete your men who see dey that one, they not complete their medication. And women, you don't complete your medication, your hygiene level. You when you get some infection, you not wash wetin your own this and all that. Sometimes you even suppose change all of them. If you not do all those things, because that on this now wetin you fit wear during the period, some of all these things fit don stick there, mostly for fungal infection. Most of the things fit don stick there, and the person go reinfect himself. So sometimes wetin you dey even wear, most people wey dey wear nylon type of underwear, wey be say once they even wash their self, after washing their self, e no dey dry, then it can also reinfect themselves. We don't talk about their hygiene. We don't talk about your hygiene already. So these are some of the things when fit cause recurrent infection. And another thing be say, sometimes this recurrent infection fit be say na the infection wey you get before na never finish. While in some cases, the infection wey you get before don finish, you just get a new infection. Yeah, you just get a new infection. Na be that one. So it can be in two ways. So one thing be say your former infection when you get never finish, so it will come. While in the other way, the former one don't finish, but you are just being infected with another infection, with another infection. So these are not just some talk about recurrent infection. And Dr. Fred.
Yeah, thank you so much, Dr. Israel. I believe, say, we dey here because I don't talk some of these things where they cause recurrent infections. One other thing again, and I know you mentioned where I talked before as well. Now, when you give some people medicine, they know they complete their medication. You go start the medicine, then you go stop halfway. You say, ah, doctor, I'm fine. Why should I complete the medicine? You don't know, say you dey set yourself up for problem later in the future. These are some of the habits where they make people they get recurrent infection. Now, because of time, so I want us to go. May we talk about what can we do. So one other thing again, if it affects you, if it make you get recurrent infection, now your immune system. Some people, their immune system is quite very poor. Your immune system no fit help you clear some infection in your system. Normally, infection wey no supposed to give you problem. Now your immune system dey there, they complain about am. These are some of the things wey fit give you recurrent infection. What can we do? How can we ensure that we don't come
So
down with recurrent infection? So, Dr. Israel, over to you.
so yeah, I dey with you. So when we talk about what we fit do so that maybe we not they come down with recurrent infection. First thing, as Dr. Fred talk, your immune system. You need to build your immune system because sometimes if we fit build our immune system, if we get good immune system, some of this infection may not even affect us at all. At first, talk less to say you can become recurrent. Then another thing I be say, make we try to complete any medication when our doctor give us. And three, self-medication dey okay. Because most people now
Mm,
self-medication now they really dey cause them not to dey treat their self well. They come dey get
mm,
resistance. This infection come dey resistance um to medication. So when you treat yourself very well, you take the drug as
true.
your doctor take prescribe for as long as many days when your doctor say tell you. Because most of this disease, some of them with the treat they will say between 5 to 7 days. Yeah. But there are some when you need to treat for like 2 weeks or even 6 weeks, you need to take medication. So not consider because the one way you need to take for 2 weeks, you don't take am for 1 week, you don't do okay. You say you not go treat again. So that na another thing. Another one na hygiene. Our hygiene level, we need to at least build up our hygiene level. For women, mostly, for women, when we talk about washing yourself, washing your kwekus and all that, we not say make you go dey chook hand for inside, dey go dey find wetin you not keep there. The inside
Mm-hmm.
itself know how to take care of itself. So now the outside,
Correct.
now we just want to make you wash. And when we say wash, we say make you wash with just water. And not be the one we can't carry sponge, can't carry alum, can't carry Dettol, can't carry everything. Say you want. No, not be like that. Just wash with water. The body will always know how to take care of that area. And also, once you get anything when you don't understand for your body, any discharge when you don't understand, when come dey smell, please run to the hospital immediately. Because some of the time when you not run to the hospital on time, sometimes it will even come take very long for the body to the extent say when we dey able to treat am, it go take some time. So hygiene is very important. You complete your medication, build your immune system. When you dey build your immune system with food wey you dey eat and every other exercise and every other thing when you fit build your immune system. And another thing is that sometimes it is also good our undies wey we dey wear make e not be nylon, make e be cotton, so that make e fit dey soak some of all this fluid wey dey our body. And when you wash, please sun dry. When we say sun dry, you dry am for sun, and then you can even iron them sef before you wear them again. And sometimes we dey always dey advise, if you dey house, you no get where you dey go, why must you wear something wey go tight all your body again? No. um and release yourself, let breeze enter your body. It is very very important, because if breeze still enter your body, at least it go still help you, and it go still help to reduce all this infection. all this infection.
Mm,
And the last one I be say, once you get infection, when you go hospital, make dem do test for you. Make dem do test
correct.
for you. Yeah, there are two ways to treat infection. We have the syndromic, the systemic. No, syndromic and yeah, syndromic and systemic. Like syndromic, when we talk about it, now symptom now you get, we just look the kind of symptom when you get, just give you drug. Then when we talk about the other way, me say we go do test for you to know the real cause of the problem. Say we treat that problem. So sometimes it
Yeah.
is very good to do test to know what organism really dey cause the problem, so that make we treat am, make dem treat that organism very well, you go dey okay. You go dey okay. So I think these are some of the few things wey we fit do wey go protect ourselves. Then we no go stop about talking about eating good food and washing your hands. You wash your hands very well. Also, another thing wey dey quick introduce infection for mostly women as well, na when you go toilet, how you take dey wash? Some people dey wash from back to front, which is wrong. But if you wash from back to front, you go sometimes introduce this infection wey dey from your bottom, you bring am come your kpekus. So you are supposed to wash from front to back, and that will also help to reduce a lot of infection. And after you do that, abeg wash your hand. Wash your hand. It is very, 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 very important. Dr. Fred.
Yeah, thank you so much, Dr. Israel. You don't really break them down, and I hope that a lot of people are listening to what you said. We have some questions here. Some of them they related to the topic. Why some of them look like not with the topic. So if your question is not related to the topic, sorry, we will not take your question. Yeah, yes, we're talking about recurrent infections and why. Hassan Aziz, good life in a sense. So let's see these comments. It's not related, but let's just see. It says, can poor immune system lead to severe weakness of the body after intercourse?
Normally, after intercourse, the person go dey weak. Normally, that na normally, because e don release things. So when you come get poor, when your immune system no come dey top notch, yeah, anything can happen. However, sometimes even knacking sef, one of the benefit of knacking na be say dey even dey help us to release some hormones, some things wey even fit still build our immune system to some extent. But you need to first of all get good immune system before you go think of say you wan use knacking take do anything like that. So yes, if you no get good immune system, knacking can actually reduce, make you weak more than as you suppose weak. However, in the main sense, knacking alone can actually make you weak to the extent say you go sleep, and when you sleep, in a way you are boosting your immune system.
Yeah, thank you so much. We have another. Okay, this one says, no, they use Isa wash your kpekus. Yes, it's surprising. This one says, so please, Dr. Israel, are you saying it's not good to use soap to wash kpekus?
What I'm saying is use water to wash your kpekus. Why will you even use soap? What is those soap made of? Now the body, that kpekus, all those side already get their own chemicals and always to make themselves they clean. So what you need to do is to, when we say assist them, you just to wash this outside part with water. With water alone, you can wash a lot of things. And with water alone, you can wash a lot of things. After all you're not there now. Oil dey there wey you say you wash am, e still dey sticky. A lot of oil dey there, so e be like grease wey you no wan. No, wash with water and e go dey clean. The inside go fit take care of itself.
Yeah, very good question. Now, you get one other thing where you mentioned, if you be a man or a woman and they treat you for infection, especially the STIs, STDs, they important make yourself treat your partner, because you notice that some people they're going to treat them and they're not going to treat their partner. So this one too, they very important. That is why it's no good for you to they hide, to the shame, to the cover mouths about things where you they treat. Make sure you tell your partner. If not, if it be one other reason, we say you go they treat something, you go they go and you go they come back. Okay. Let's see. Let's see. Do we have more questions here? Do we have questions here? Let's see. So, okay, we have a comment here. It says, where can we get vaccinated? This one is coming from Richard. Where can we get vaccinated?
Okay, and vaccination, if you did in Nigeria, go to any primary center and you can actually get vaccine there. But you need to ask them which of the vaccine you can take and they will give you within that period. Because most of the time, when we talk about vaccination, it's in the hands of primary health center. So if you did Lagos, the primary health center, they work very well. So you can actually get most of the vaccines in primary health center. Then there are some good government, some good private hospitals that also do immunization. So go and meet them, and then you can get those vaccines. But say when you go private hospital and even some government hospital, you will need, and depends on the kind of vaccine, you may need to pay some amount of money. Yeah, so just have that in the back of your mind.
So this question is a very let's take it for so many reasons. It says, my able doctor, please. I just treated staff warts. What is this? Staff warts. How long am I supposed to take my medicine? Who they treat you for this one? Now it's obvious, Mr. Charles. No be doctor they treat you. Now roadside. Now you they treat yourself, and you go develop severe problems because it's obvious. Say if you didn't listen to us from the beginning, we mentioned that if you think you have a problem like this or you get infection, see a medical professional first. Then they go do tests for you, and then they go tell you this medicine where you go take this and this, how you go take them. You can't just wake up, Mr. Waiting be your name, Charles. You go they collect medicine for waiting you don't know, and then you they ask us how long. Not be we they treat you now. It's not done like that. You know, if you go collect medicine from where we don't know, you can't come, they meet us, they tell us, say how long you go take the medicine. That is very bad. And you can put yourself in serious trouble with infection. I don't know if Dr. Israel get anything to add with that.
No. I don't have.
Okay. So before we continue, let's see yeah, before we continue. So for all the people where they talk, say they want to get my course on content creation. If you want to get my course on content creation, look on your screen. There is a code on your screen. Can you see the code? There's a barcode on your screen. Now, when you see that barcode there, I don't know where it is, whether on left or right, or that is here, right? Something like this. I think, is it this or here? I don't know. Scan this code. The
Now your
moment you
second one.
like this, that means not here. Abi?
Yes.
Okay.
Yes.
So the barcode, check here. Scan this code. The moment you scan the code, automatically it will take you to the course. It go help you pay. You go get them. So just scan this code where they see for your screen right now. It will help you get the course. No need to look for any link. Just scan them, and you'll be able to get the course and learn so that you will not suffer your page. Let's see if we have more comments here. Let me see. Dr. Israel, blessing, now you go read the comment. Oh, it says, na chemist they treat them. Dr. Israel, want to respond?
Yeah. No. It's just saying what. Okay. It's just saying what was okay. This other one say. Charles say no, sir, no doctor treats me, but they didn't tell me how long I will take it. Okay, I think and maybe they say now doctor treat am, but they not know how long you go take am. They go make the prescription. So they make prescription for you. So now that prescription you go follow. So when you go buy the drug, they are supposed to give you the drug as the prescription take be. So if the prescription say now for 1 week, or now 2 weeks, or now 5 days, or how many days, he did that prescription. So I
Yeah.
believe say if you don't buy the drug, if you buy the complete drug when they your prescription, once you take and finish, it means say you don't complete your treatment. Yeah.
Correct. Okay. Do we have more questions? Because of the Nigerian match, the score right now is 1-1. They don't equalize. So that is why I think we have a lot of people not watching, not here today. And then after the live session, I believe that they will all be back, and they will watch the replay. So do we have any comments, any questions? If we don't get question, then we go do a brief recap and then we round up so that those who won't go watch the Nigerian match can do so. It's a very, very important one. So Dr. Israel, let's do a brief recap.
Okay, yeah. Thank you for reminding me. Who scored the goal save? Na Nigeria first score or na Congo DR first score?
Nigeria first score and then they just equalized.
Okay, and okay, that's Nigeria for you. For a brief recap, when they talk about recurrent infection, and we say that recurrent infection and when they get infection continuously, like you get infection, you treat yourself, it come back again, you treat yourself, it come back again. So we got to say recurrent infection fit be say the when you treat them the first time, you not treat and finish, and I make and come back again. Why it can also be say you treat and finish, but you are reinfected again. I want to say, okay, ways when person fit get reinfected or feel be like that is that, or if it be say you know the infection never go finish. Now one, it may say if you treat yourself and your partner not treat himself, you can go back and get the infection from your partner again. So that can become a cycle. You go to treat yourself continuously. And two, when they prescribe medication for you, you not finish, and because the symptom don't stop, it can be say the infection itself never go finish. So now make if you come back again. We can talk about your hygiene level that you need to increase your hygiene level. We can talk about immune system. Say your immune system, you need to improve your immune system. Then we can talk about vaccine, because there are some infection that vaccination can actually take care of. One, HPV. Two, hepatitis B. Vaccination can actually take care of those two of those infections. There are others, but I just mentioned those two. So when you take vaccination, you just know that you take care of those two infections. So that make we also talk about vaccination. Then we can go forward to look at how we go make sure say this thing not happen again. Well, we can't talk say if you get anything, you notice anything for your body, make you quickly rush go hospital. Not go any other place, not go do other things. Please rush go hospital. Another thing when I not talk in the time when we talk, but I'll talk as I do this recap, is that I beg when you want to treat yourself, you hear say you get one discharge on one thing. I beg, not come they do some. There are so many things where people they do. Many things where you take they rub your body, just say you they form, say you they treat yourself. And some people will use leaf, they wash their kwekus. Some people go put along. Some people go carry agbo, come pour am for inside there, they wash and like say you know they help yourself. You know they help yourself. In fact, by doing all those things, you feel they even they introduce another infection enter your body. You feel they introduce another infection enter your body. So please don't do that. Go to the hospital. Go to the hospital, and you go also they very good. May they test you. May they test you so that may they know the kind of bacteria or the kind of virus or the kind of fungi or parasite, whatever they cause the infection, so that you will be treated. Because it was saying no good to the wear nylon underwear, it could go the wear cotton underwear so that it go feel the help us dey dry ourselves. And it's also very important say when you dey bath, not go dey find wetin you not keep for where for inside your kwekus, leave am, because those side go always fit take care of itself. However, for the outside, you wash am, and when you wan wash, you wash with water Hospital say if you dey house, abeg, if you dey house, abeg, you fit just you fit leave yourself, you fit not wear underwear and all those things. Let breeze enter your body. E go also help you um very e go also help you very very well. And then I think then we can't answer some questions that was asked, and we also let you know say yes, if your immune system dey low and you go knack, man, your immune system go reduce more more. However, even normally, even with your good immune system, after knacking, you e fit make you weak and sleep off. And the process of sleeping, you be rebuilding your immune system. So this one are some of the recap when I went to today.
Yeah, thank you so much, Dr. Israel. For the person where they ask us about HPV, human papilloma virus, and get vaccine, Dr. Israel mentioned it. So if you never see, I just put the picture up on the screen right now so that you feel see them, and then you know waiting how it be, so that you know go talk say you know waiting we they talk about. And then we spoke about the one for hepatitis. Hepatitis B vaccine as well. If you never get them, this one too now some ways where you fit take help yourself and protect yourself. May you know come down with this infection. Do you understand? Very important. And then I beg, try to also improve your hygiene. Improve your hygiene. This one they extremely important. Wash your hands when you cook. Make sure so you prepare your food well, you cover your food well, you cover your water well, and then every other advice way we give you. Yeah. So I think we don't try. If you just they come, you go need to go back and watch from the very beginning, so that make you understand what we talk about. Recurrent infections no be better thing, and some people now them use their hand cause them. They don't use your hand go develop resistance. They will give them medicine and then no go finish them. Because of that, the medicine no they work for their body again. So I hope say we don't try, we don't break them down for you, and share this video so that those people will know come, they go see them. This person says, and good life now sense. Thanks so much for today's education. I really enjoyed today's education. God bless the both of you. God bless you as well. Yeah, okay. So, is there any final words as we round up?
Okay. I want to say a big thank you to everybody, to you when they join us all the time, every Sunday, and they follow us. Also, I want to still use this opportunity to tell those when they follow me on my page, Facebook to be precise, most of the time, yeah. Most we know sometimes we know there's some message you send, private message, we not go respond to you. Eh? Not because we don't want to respond to you, just because that's not the medium where we will be able to talk to you. So if you really want a private consultation, you want to ask us questions, you want us to talk to you one on one, and once you send message, we will drop what you want, what we suppose drop. Follow through that, process, so that you can actually talk to us one on one, and then we can actually give you our time, because our time they very precious. So we really need you to so understand. It's not like we don't want to talk to you, but you need to follow the due process and do the right thing, what you are supposed to do. Uh, Also, Dr. Fred, thank you so much for today's session as well.
Yeah, thank you so much, Dr. Israel, for that. One more time for anybody we won't get the course. If you want to get my course on content creation, click, just scan this QR code on the page. Scan them, carry your phone, scan them. Quickly, you go get the course. Go and watch, go and learn, so that you don't come back and start crying. This is very important. It's easy for you now. We don't try to make sure, say, you know, go they travel to go find how to get the course. Just scan this code and straight away you are there. Thank you for watching. Thank you for joining us. We go day here again next Sunday. The time is 8 p.m. Not come late. 8 p.m. to 9 p.m. every Sunday on this platform. Like I always say, good life now waiting. Good life, good life in a sense. So take care and have a wonderful evening. Bye bye.